Welcome back, and in case you're just joining us, the CEO of the National Primary Healthcare Development Agency, Dr. Mohammed, is our guest on Question Time. Now, let's look at the innovations now being injected by the federal government in fighting the spread of polio virus. Tell us some of these innovations.
The first innovation, which is, a kind of orientation, is the ownership taken by Nigerians. That yes, this is a program that should be country-driven and then supported by partners. So that is first approach. But coming to specifics, we brought in a lot of innovation into the program. In 2012, when we had a lot of cases, we said it cannot be business as usual. That unusual approach also give good results. And we first brought in accountability into the program in such a way that people are held accountable for their action or inaction. People are expected to deliver on certain milestone. And if that is not done, then we'll sanction people. And if people actually meet those milestones, they are rewarded. That is for the health workers. And we also expect that from other stakeholders, including non-governmental organizations, including partners. Secondly, we established the Emergency Operations Center. The Emergency Operations Center, we have one at the national level, and then in all the 11 endemic states. And they are supposed to provide tactical and operational coordination of the polio program in such a way that it's a 24 hours center where it's being fashioned as a kind of war station room. And they work 24 hours and they map what happens in every local government and every location in this country. And programs are fine-tuned based on facts, based on data, based on information. What happens in one location is different from the program direction and program approach in another direction. So it's a data-driven program, specifics. Thirdly, we also look at learning from experience, how we can further improve upon the program. And another intervention we brought in, particularly in the Northeast, which is a major challenge, Borno and Yobe, is the hit and run strategy. The hit and run strategy means when there is relative peace, we'll move in with a large number of vaccinators, we'll immunize children, and then get out immediately. And that has worked, because before then, what really happened was in a day, we lost about 16 vaccinators who were killed in a single day. And we said, while preventing Nigerian children from getting paralysis, we'll also not unnecessarily expose the health workers. So we move in and vaccinate and then get out. We also have in place the health camps. In some locations in this country, while people refuse to accept immunization, it's because their health needs are not being addressed. So we use the health camp as a platform to administer other health needs and felt needs of the populace and use that platform to immunize children.
Now, what does the introduction of the injectable polio vaccines represent for Nigeria's quest to have a polio-free country?
It's another innovation that we brought into the program. What we realize is that in some locations in this country, particularly in the Northeast, assessing children is difficult. There is a period during the peak of insurgency that about 70 to 80% of Borno states we couldn't assess it, leaving only 20% accessible. The IPV, which is the inactivated polio vaccine, is an injectable. By the time a child receives 2 doses of OPV, and then you follow it up with inactivated polio vaccine injectable, then it will move the seroconversion and the protection that child has to almost 80–85%, which is good, very good. So we now, because we know that some locations have accessibility problem, we now brought in the use of IPV so that we can consolidate on the gains we've made by dropping OPV, so that when we don't get that child again, we know that that child is well protected. And if he comes into contact with wild polio virus, it's not likely that he'll be paralyzed.
Now, what's the turnout like? Because now this campaign is something that demands a lot of awareness for people to come out, those who believe and understand what you're set out to do. Because in some areas we still have religious and cultural belief which could stand as a stigma. So what's the turnout like in especially these most infected areas?
Yes, before we were able to convince the populace, like, for example, in 2011 and 2012, we had a lot of organized refusal rejection due to misinformation, due to wrong perception, and then due to a lot of mischief by certain group of people that went out with the message that the polio vaccine is not safe, that the polio vaccine is being used to depopulate certain part of the country. And we engage the community directly. We brought in traditional leaders, we brought in religious leaders, we brought in civil society organizations, and in partnership with traditional leaders, we were able to resolve most of these issues. We're able to resolve most of the controversies. We're able to clarify issues and then send out those messages that polio vaccine is safe and is very efficient in terms of preventing paralysis. And with that, we established what is known as the Traditional Leaders Committee on Polio, which is been led by His Eminence, the Sultan of Sokoto. So engaging traditional leaders assisted us tremendously in terms of resolving most of the challenge. As it is now, we don't have structured, organized refusal against polio vaccine. We have pockets of refusal and rejection. And as they arise, we resolve them in partnership with traditional institutions.
Before we wind down this conversation, tell us about the federal government intervention in fighting the spread of polio virus in the country, and also the contribution of the foreign partners in fighting this scourge.
You need to understand the funding for polio eradication in Nigeria. We receive support from donors, from partners. And Nigeria provides some kind of counterpart into a basket funding arrangement that is being managed by WHO and UNICEF, because partners also pool resources into that basket. And we see it as a team, and then clearly bring out activities, which is contained within the financial resource requirement for polio. Yeah, partners, in fact, the Nigerian government provides only about 30% of the requirement for funding polio program in Nigeria. But we consistently in the last 4 years, the Nigerian government has been spending, contributing $50 million annually into the polio funding. But partners also contribute. Partners also provide funding.
Well, I think that's something we could calculate later, since you are saying that the federal government contributes 30%, which is about $50 million US annually. But before we finally put a seal on this conversation, what's the assurance that Nigeria stands a good chance to get this full certification come to 2017? In
line with the directive of Mr. President, we will ensure that no child again get paralyzed by our poliovirus in Nigeria. We will sustain the gain. We will maintain the zero polio case status of Nigeria, so that by 2017, we'll attain certification and we'll be able to eradicate our polio virus. Between now and then, a lot of things need to be done. We'll continue with the campaigns, and then we'll keep on improving the quality of the campaigns. We'll continue with ensuring that routine immunization works and works very well, so that in every facility in this country, there will be routine vaccines where people can walk into and then get their ward and children immunized. And then we'll also continue to intensify surveillance system. It's a journey that we've started, and we've made the first break, because since the polio eradication effort started in 1996 in Nigeria, Nigeria has not ever, the highest we've ever stayed without a case of poliovirus is 1 month. This is the first time that we've attained a year. And by the time a country attains a year without a case, that country has interrupted. So as it is now, by the time we get the pending samples from the lab cleared by WHO, then we'll be issued with a formal communication delisting, removing Nigeria as a polio endemic country, leaving only Pakistan and Afghanistan.
Dr. Adom Mohammed, thank you very much for joining us on this episode of Question Time, and also for telling us what the federal government is doing and also its parastatals is doing in ensuring that Nigeria gets the full certification of a polio-free Nigeria come 2017 by the World Health Organization. Thank you very much indeed. And that's as much as we can take on this episode of Question Time. You may also send us your comments on our various social media platforms showing on your screen. Join us next week on another exciting episode of the show on Channels Television. Many thanks for watching. I'm Benga Ashiru saying goodbye.